Hello, my name is Ivy. I'm a fourth year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I will be talking about hoarding disorder. In this video, we'll first look at what hoarding disorder is. We'll then look at the risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. A hoarding disorder is a mental health condition that involves acquiring an excessive amount of items and having difficulty discarding the items due to a perceived need to save them. The accumulation of items, which can be of little or no monetary value, creates unmanageable clutter in a person's living spaces. The clutter can be incredibly distressing, and it can negatively impact the quality of people's lives. It can impact their relationships with other people who try to clear their clutter as well. Hoarding disorders differ from collecting, as collectors collect a specific type of item for sentimental purposes, whereas people with hoarding disorders usually acquire a variety of items and store them in a chaotic manner. Common items that a person with hoarding disorder may accumulate include newspapers, magazines, bills, books, clothing, ornaments, and kitchenware. Hoarding disorder affects 2 to 6% of people in their lifetime. It equally affects males and females. The average age of onset for hoarding disorder is 13 years old, although the symptoms tend to be mild. Hoarding disorder worsens and starts to interfere with daily life around the age of 20, and it becomes more severe after the age of 30. People who are 55 and older are 3 times more likely to develop hoarding disorder than younger adults. Risk factors and causes. According to researchers, people are more likely to develop hoarding disorder if they have a family history of hoarding disorder, a stressful or traumatic life event, such as a severe illness or divorce, brain injury, impulse shopping habits, substance use disorder or alcohol use disorder, Prader-Willi syndrome, differences in neuropsychological abilities including organizing, planning, problem solving, working memory, sustained attention, and visuospatial learning and memory. Symptoms. People with hoarding disorder may have the following symptoms: inability discarding possessions, extreme anxiety during attempts to discard items, indecisiveness about what to keep and where to store belongings, difficulty organizing items, feeling distress about possessions, being suspicious of items being touched by other people, feeling anxious at the idea of running out of an item or needing it in the future, a decrease of living space, social isolation. The physical symptoms of hoarding disorder can include thrilling sensation, exhaustion and fatigue, and muscle tension, while the emotional symptoms can include anxiety, fear, grief, confusion, excitement, shame, frustration, and anger. Effects. The outlook for hoarding disorder is poor, as it can impede a person's daily life. It can lead to complications such as a lack of living space to do daily tasks, such as sleeping or cooking, unsafe living conditions, which can cause fire hazards, trips, or falls, poor hygiene, strained relationships, including family conflicts, social isolation and loneliness, divorce, eviction, unemployment, financial issues such as debt, legal issues such as loss of child custody. It can also affect children's social development. People with hoarding disorder may also develop mental health conditions such as depression, anxiety disorder, and alcohol use disorder. The most common treatment for hoarding disorder is cognitive behavioral therapy, or CBT. CBT can help a person understand and change their thoughts and behaviors. A therapist can help them understand the reasons for their reluctance to throw away things and the reasons why clutter has accumulated. CBT can help a person with hoarding disorder improve their decision making and organizational skills, help them conquer their desire to save items, and encourage them to gradually clear their clutter. Antidepressants, such as selective serotonin reuptake inhibitors, may also be prescribed by a healthcare professional to help treat the symptoms of hoarding disorder. Coping strategies. There are a few coping strategies that a person with hoarding disorder can utilize. They can seek emotional support. Social isolation is a common effect of hoarding disorder. It is important to reach out to someone you trust to relieve stress and feel better. Practice self-care. It is imperative for a person with hoarding disorder to eat healthy and practice good hygiene. Taking care of oneself can help a person feel happier and encourage them to keep their home free of clutter. Take one step at a time. Letting go of one's possessions can be overwhelming. It can be helpful to break large tasks into smaller ones. Seek help for decluttering. Calling friends, family, or professional cleaning services can make cleaning and organizing a lot easier. A loved one can support someone with hoarding disorder by stop helping or cooperating with a person's hoarding, provide emotional support without criticizing, discuss how to make the living space safer, and encourage them to seek treatment. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.